Картка для України. Нашими спікерами будуть Мар'яна Онуфрик, експерт з питань соціальної політики Інституту суспільно-економічних досліджень, Лариса Самсонова, голова правління громадської організації «Rodyna», Halyna Kurylo, директор міжнародної організації захисту прав.
Our next briefing is on implementing the UN Convention on the Rights of Persons with Diabetes, a red card for Ukraine. With disabilities, a red card for Ukraine. Good afternoon, esteemed friends. I am from the NGO Rodyna, which was founded in 2000. This year we are 15 and we support families who have children with heavy disorders in development. Will learn how to enjoy life. We dream about life with the social support like all normal people. The mission of our organization is to develop the system of social services which will help families to prevent institutionalization of a child, to ensure that the child could live independently in the future. Such services are to be provided to such person starting from the birth till the end of life. Our objective is not just to ensure, to organize sanitary support for a person. We want to see in such a person the individuality. We understand that every child with disability tests us whether we can address and refer and treat such people with dignity as anyone else. And the most important thing is that our children are always children, even when they grow up. I would like to say that the parents of such children always have a moral choice. No one knows how to bring up such a child, what to do if the child doesn't talk, what to do if a child depends 24 hours a day on others. And for that, the psychological support, social and medical support are needed, and additional resources, the advice and the assistance of others. I know exactly that to blame the parents who in despair give such child to the orphanage, they cannot be blamed, they cannot be accused. That is not their guilt. Maybe they have not met the professionals could help them to understand and to resolve the problems. One of the problems is the absence in Ukraine of early interference program, the program that prevents institutionalization, also introducing inclusion, the main factor for preventing institutionalization. This process of inclusion is very chaotic in Ukraine. We have been talking about these problems at the Ukrainian conference, what slows down inclusive in Ukraine. At this conference, we managed to listen to every stakeholder, and we realized that the beginning of a normal, real, inclusive education will help us see and will make our children seen so that this is discussed in our society. The role of civil organizations is very important in this process. The parents are now providing such important social services, and now it's happening without the proper support of the state. We dream that we dream how we could learn to stand for the rights of a child in the family, but we will not be able to cope without the support of the society. We believe that the setting up of the centers of daycare for such children, the system of support of adults, the development of the programs of early prevention will gradually lead to closing the institutions for such children. We believe that now when we are implementing decentralization, we believe that the local authorities will get more powers now. And we want local authorities also to understand and to pay attention to our problems. We request the Kiev authorities to help the NGOs and other participants of the services to develop the services which would be alternative to the state services, so that the Kiev authorities provide resources, and we hope that we will get to the mechanism which is called social order, when the state itself cannot address all the problems. They order such services from the state. This year, the representative of our organization made an alternative report in the United Nations. Why I call it alternative to alternative? Marianna Onufryk was making this report, and she was talking about the rights of disabled people in the committee of the UN, when Ukraine was asked the question about how Ukraine follows the Convention on the Rights of Disabled People. I'm Marianna Onufryk. I am from the Rodyna organization, where I am the member of this organization, and also I'm the expert of the social policy. The convention, UN Convention on the Rights of Disabled People, unfortunately it's called about the rights of invalid people, and the committee states it should be the rights of the people with disabilities. There is such a procedure when when every state has once every 4 years to report on how the convention is being implemented. And this year was the year when our country had to report to the committee on the situation with that. Unfortunately, we have very few successes. As to positive aspects, the committee managed to mention only 5 of them in their recommendations, and they are all about introducing amendments to the legislation. We understand that in case of Ukraine, introducing amendments to the legislation does not guarantee that this policy is implemented. But the comments and recommendations, there were 9 pages of them. Because I represent the organization which is working with the children with disability, I had an alternative report in Geneva on Article 7 of Convention. It's on children with disability. Larysa has already described some of the problems, but the main aspect which we are concerned with. And we are happy that the committee has perceived our remarks, and many of the experts, most of them are of the recommendations are included into the recommendations of the committee. There are recommendations on implementing inclusion or early prevention. We can say a few words about inclusion. In Ukraine, we have 120. As of 1st of January of 2015, there are 120,000 children with disability who are of school age, and only 2,000 of them are in inclusive classes. 59,000 children study in regular classes. We can make a conclusion that about 60,000 children are outside of the system of general education. They are either at home or they are in orphanages and specialized institutions. Especially because now the inclusion is replaced by segregation. When the groups in preschool institutions are called exclusion, some groups for certain nosology. The children with the problems with hearing, they are in a separate group. This is not inclusion. We're happy that the committee listened to our advice. Every child has the right to be in a family, and the state has to help such forms of education. Definitely, there were many recommendations as to other categories of people, to adults and other vulnerable groups of people. There were many recommendations as to the policy of the state during the military conflict in the East, because we know that the members of the committee were very much concerned with the situation when different orphanage institutions were not evacuated. And the state has to pay attention to that. As to the mechanisms, how this should be done, we came not just to criticize the authorities. We all understand that that is the policy that has been developed back in Soviet times, but we would like to provide recommendations on how this process could be affected, how the state could exercise all the recommendations. There is the National Council on Reforms set up by the President of Ukraine, where 18 project officers are working, and there are 18 priorities of the state policy in the sphere of reform. Among these 18, there's no reform of social protection, even though, according to the statistical information, more than 40% of people are those who are getting subsidies or privileges. We have this situation with IDPs, with participants of ATO, but the policy is not prioritized. Talking this policy is very comprehensive and interdisciplinary. As to early prevention, that is under the sphere of public health. Talking about accessibility, the Ministry of Construction. Talking about inclusion, that is the Ministry of Education who are responsible for that. So we believe that the mechanism of prioritizing the reforms in the sphere of protection of the rights of people with disability are of importance. Also, I would like to mention that the members of the committee expressed a lot of attention about institutionalization of adults and children. And I would like to give the floor to the director of the institution of director of DRI-Ukraine, Halyna Kurylo, Director of DRI-Ukraine. As Marianna has mentioned, the main strategic objective of the Disability Rights International is to put an end to the segregation of the people with disability. In April 2015, we presented our report. The report is the result of our work in Ukraine from 2012 to 2015. We visited 33 orphanages or institutions for children and adults. That report is the part of the global campaign Stop Institutionalization of Adults and Children, because institutions are a dangerous place for children. Even those children who have no disability, they become disabled because the institutions do a lot of harm to health. We documented many violations of human rights. First of all, the human trafficking problem is what concerns us a lot. Everyone knows that this is happening, but because it is very difficult to find evidence, people are not talking about that officially. There's no system of monitoring the institution. No one can say how many children are registered. It's from 70,000 to 200,000 of institutionalized children, because different ministries are accounting for different children, and very often we calculate not the number of children but number of beds. And if we add volunteer tourism, we know that in our institutions that many foreign citizens have access to the institutions. No one but the director of the institution can control them. Any foreigner giving some contribution can come and spend time with children. Also, there were visits to the US when children were taken for vacations, and we have no information about where these children went. In most cases, this ended up nicely, but also there is a sexual exploitation which is happening inside the institution and outside. When we are talking about children who live in the institution and who come out of the institution, they're not adapted to life. They're very naive. They don't understand what's happening. It's very easy to take them and to make them prostitutes, to take them somewhere to work. And these things are happening. They know that their friends are doing that. And again, the mainstream is the forced labor, not just in the institution but outside. When children or young people, they are taken to work for a week to do something, like to help plant in the field. Then another problem is violence. Once we are talking about the closed type institutions, this violence happens there with the doors closed, and there's a social violence, sexual violence also. And it's not just between the personnel and the residents, but between the residents. Those children who were raped, they grow up and they start raping younger children. Especially this happens in the institutions where only boys stay, and we see lots of undesirable pregnancies, but Then there are also forced abortions made. And also there is improper care in the institutions of the third and fourth profile, and we were not trying to blame the personnel, the staff, because they do everything they can, but because of the lack of funds, it is impossible to organize a very good care. And those children who had disability, they basically their situation worsens. And it's not the accusation, it is a systemic problem. We found it in different regions at different levels, even where the directors were good directors. And that is why we produced many recommendations, but the main one is that at the level of the government there should be the national plan of deinstitutionalization. And Natalia Andreeva will talk about providing services to the community. I'm the chairperson of the board of the NGO of protecting the rights of children with autism, Natalia Andreeva. All the children that our organization is taking care of, these are children with special psychological development. Some of them have disabilities, some of them don't. But this is a big problem all over the world, because the children with autism, there are 1% of the population of the world of such people. But why Ukraine is a unique state today, despite the fact that at the legislative level we implement the Convention of the Rights of Children and the Convention of the Rights of People with Disability, and that the laws are being drafted a lot of documents are developed which help to start inclusion from a preschool age, but it all stops at the level of the community, at the level of implementing these regulatory acts, because we see a lot of resistance from the educational establishments, from the social protection social protection bodies. We have the impression that we are trying to build a beautiful building without changing the foundation. And now a lot of attention is to be paid, and I would like to address both parents and communities. The parents have to stand for the rights of their children, so that the children are not placed to the institutions, to stand for the right of the child to get education, inclusive education, because until now we still see the cases when they recommend to give a child to the institution when there is a big chance to get such a child ready to life, trying to teach such child the things that could be taught. Such organizations as ours take up this responsibility, and they provide rehabilitation services, they help parents. Sometimes they create the hostels, but we do not feel any support from the community. For example, let's take Kiev, which is the capital of the country. the city which could allow a lot, could afford a lot. We can afford beautiful buildings, we can afford great entertainment establishments, but our community does not support social initiatives which unite the parents who are trying to avoid institutionalization, which so that the child does not become disabled child even in the beginning of their life. Our organizations are not getting any support. That was blow on us because Kiev city administration has recently passed a new lease, a new policy on paying rent, and our organization has to pay same rent as businesses like restaurants or shops. When we organize the daycare, the rehabilitation for children, our organization, for example, provides services to children starting from 2 years, and the oldest child is 21. Our organization has a choice now whether we need to develop, whether we should try to create good conditions so that they can live in the community if something happens with their parents. No other organizations in this city, but the organizations set up by parents, do not provide such wide spectrum of services for children with heavy disorders of development. Organizations in the country do not receive the support from the community. Though we all are the taxpayers, the parents of such children, we are paying taxes and we are not imposing all the problems on the state. We are trying to resolve all the problems ourselves, but we do not receive any support. And I believe that both the parents and the community have to think about the situation when such people have the right to not to be isolated. They need to receive all the support and all the reforms which we are trying to implement are to be the reforms which will be protecting them. No decision which is made up there on the top will not be implemented in the community if the community does not respect this or does not accept this decision. The questions now. Gamma TV channel. Thank you for your work, and the question is to all of you. Is Ukrainian society now ready to overcome this segregation? Do you have any recommendations how to work with the community that does not see people with disability all the time? The first step is the community should see such children. If they are closed in the institution, the community doesn't see them. If the community is used to call these groups blind, deaf, mentally detained, and the first step is to make these people visible. And for that, we need to overcome many barriers. For example, just imagine how a child gets to school. If this is a regular child, the child goes to school. If this is a child with special needs, it should have first medical consultation, which will advise which establishment to go to. Then they suggest several systemic classes, and the parents are afraid of these consultations, and I believe that the community may help if they are very tolerant to those who they see in the street, in the shop, when there will be no strikes, when the parents of healthy children strike against other children, when the law on education, which is discussed in the community, will exclude. There's a section on the education of children with special needs, but there's one item that says that the child with special needs can study in regular school if such child does not hamper other children. I just would like to add that we cannot wait till the society is ready, because we will never be ready. As Larysa said, we do not see such children, such people, this first part, because we need to overcome this psychological barrier. And so basically this inclusion is to be forced in. Because Ukraine has ratified such convention, one of the articles of convention is that the state takes the responsibility to organize awareness campaigns. But in reality, Ukraine has such commitment. I will add, if we are saying today that inclusion becomes one of the types of education, and our children who have disabilities, who have problems with development, despite the fact that according to the law on education and according to the new draft law, the main program priorities are quality and accessibility of education, and children with special needs have no accessibility. We need to have this consultation then in the Department of Education. The Department of Education sends the mother with this child to educational establishment, and they will say, we cannot take your child because we have no place for your child. So we just then go circles to say nothing that such a child we should get the opinion of all the doctors. Our children get stressed when talking to this commission. I haven't seen a single family that wouldn't get psychological stress, and our children do not get to schools which are close to house. And the children who grow up with that child in one courtyard, they don't see this child. But if other children see this child and they help this child, and children are very kind. But we have the resistance of adults. I can say that the biggest resistance we get from children, from teachers. We need to retrain the teachers, and the state has to pay attention to that, to pay not just attention but to allocate some time and money, and maybe invite those people who will help in that. Any other questions? Then there will be one more clarification. I've heard that now Kiev city authorities are charging more for renting the premises by NGOs. Did you address the Kiev authorities so that they do not increase the rent? Yes, we wrote letters to Klitschko. We were at the Committee on Education. We were at the Committee on Budget. Unfortunately, the situation is strange when no one knows who did it, because first there was a while that they said that it happened when all the educational establishment institutions were equaled with commercial, and they started paying high rent and high tariffs for communal services under Chernovetsky. There were different gradations. Now they decided to make everyone equal, and we just got this situation. Unfortunately, and the institutions of other forms of ownership cannot develop, and the market of services is not created. I believe that during elections, they tell us in different committees that these issues will not be addressed now. Let's do it gradually. There should be a separate program passed for organizations that carry on socially important project. So it's not clear how it is developed. Kiev is the worst city for the development of commercial sector. This is a commercial city. When you go to regions, all others believe that everything is great, but Kiev is the most difficult place for implementing social projects. Once you have no more questions, we will finish our briefing on that. Thank you for your very difficult work, and see you.